Welcome to Podcast 3. We're going to take a quick review of elbow anatomy. As before, this should be a review. If it's not, please check with your other anatomical resources. Just like with the shoulder, by the end of this podcast, you should be able to explain the anatomy of the elbow with a layers model and to identify the function of critical movers and stabilizers. Rule 1 here is a lieutenant not quite so obvious statement. The elbow flexes and extends through the movement of the radius and ulna together on the humerus, but it also performs pronation-supination movements together with the wrist, and this is the radius moving around the ulna and rotating on the humerus. Unlike the shoulder joint, the elbow gets a fair bit of stability from its basic bony shapes. The main reason to recognize the three distinct articulations here is that different conditions may disproportionately affect some of the articulations, but not all. The elbow joint sits pretty close to the skin layer compared with the shoulder. That said, there are important muscle layers to note. Two bony prominences just proximal to the joint on the humerus, the epicondyles, act as major origin points for the long extensors and the flexor pronators of the forearm and wrist. The triceps and biceps brachialis brachioradialis cover posterior and anterior of the elbow, providing the main motors of the elbow and also providing some dynamic stability of the elbow joint. The elbow being a synovial joint, the deepest layer is the capsule and capsular ligaments. The anterior capsule to a small extent, and the medial and lateral collateral ligaments to a large extent, are important static stabilizers of the elbow. Just like all the other synovial joints, the same arthropathies can happen in the elbow. Like the shoulder, the elbow has an important bursa, the olecranon bursa. This sits between the skin and the tip of the olecranon posteriorly and is supposed to allow the skin to glide over the bone more easily. Dealing with the complex layers of muscle in the forearm starts to cross over with the hand and wrist session, so we won't dwell on it much here. But again, the key here is to recall the overall function of each layer group compartment. Muscles originating on the lateral epicondyle and running down the dorsal forearm are typically extensors of the wrist and digits. Muscles originating on the medial epicondyle and running down the volar forearm produce flexion of wrist and digits and pronation of the forearm. There are some nuances here, but this will do for now. So this was a very brief review of elbow anatomy. As before, the key points to remember are the layers and the important movers and stabilizers, which I've listed here to sum up. For further detail, check out your other anatomical resources.